Hello everyone, my name is Chelsea and I'm here to provide you guys some important info regarding fluoroscopy. I chose to teach about fluoroscopy for this project because I've been employed in healthcare the last 3 years as a radiology transporter. I've always wanted to be given the opportunity to help assist the physician when performing procedures on patients. After X-rays were discovered by Roentgen in 1895, the fluoroscope was invented by Thomas Edison in 1896, and his assistant was Clarence Daly. When radiologists first performed conventional fluoroscopy, they had to dark adapt their eyes for 20 to 30 minutes, where it was required to wear red goggles to see dim images. Compared to a radiographic examination, the primary purpose of a fluoroscopic examination is to visualize dynamic images. This dynamic radiographic exam has the ability to provide an active diagnosis. Basically, fluoroscopy shows a continuous X-ray image and plays out like a movie. The X-ray images appear on a video screen in real time, which allows the radiologist to see how well the structure is functioning. Unlike conventional fluoroscopy, digital fluoroscopy has a more complex operating console and increased speed of image acquisition. Fluoroscopy is capable of producing high contrast studies, and the doctor recommends fluoroscopy to diagnose a disease and to guide invasive treatments if the patient meets the criteria. The type of equipment that is used during fluoroscopy is a C-shaped arm, which has the ability to scan the full length of the table while the patient is draped. The fluoroscopy X-ray tube is usually located underneath and inside the table. The Bucky slot cover shields the opening under the fluoroscopy table that houses the Bucky tray. It's recommended that fluoroscopic equipment should be inspected every 6 months. Vidicon is the type of camera that is often used in television fluoroscopy. Plumicon is also a type of television camera to be used in television fluoroscopy, but Vidicon is the most common one. The most important component of the television monitor is the cathode side of the tube. The electron beam in the television camera tube is produced by thermionic emission. The purpose of the electrostatic lens is to accelerate and focus the electron stream, which carries the fluoroscopic image. The electron beam of the television camera is also collimation. This image on the right basically describes what the components of the fluoroscopic system are. The television camera tube has the ability to convert light image from the output phosphor to an electric signal, which is then sent to the monitor with an image on the screen. The television camera tube brightness level can be increased electronically without increasing patient dose, while also allowing for storage of the image in its electric form. Resolution of fluoroscopy with image intensification can vary according to its electrostatic lenses and focal spot. The brightness of the fluoroscopic exam depends primarily on kVp, MAS, and the anatomy being examined. Fluoroscopy normally requires a tube current of 1 to 5 MAS. The fluoroscopic system designed to maintain constant image intensity is automatic brightness stabilization, which is also short for ABS. When an image intensifier receives X-rays at the input phosphor, visible light is emitted at the output phosphor. The image intensifier brightness gain increases with increasing flux gain. The input phosphor of image intensifiers is cesium iodide, while the output phosphor is zinc sodium sulfate. The technologist has several responsibilities before performing fluoroscopy on any exam. The technologist is required to obtain a patient history, any allergies to contrast, any recent scans or recent surgeries. A consent form must be obtained before going through any procedure. It's required that jewelry and metal objects, if applicable, can be left at home or in the patient room. The technologist must confirm of an HCG depending on the female's age and if the patient is currently breastfeeding. At the end, the radiologist is the one who reviews the fluoroscopy exams and discusses it with the doctor. Fluoroscopic exams can be performed in interventional radiology, X-ray, CAT scan, catheterization lab, and the operating room. When it comes to the cath lab, there is a cardiologist and cath lab technologist who uses fluoro to visualize the arteries of the heart and chambers of the heart to treat any stenosis or any abnormalities detected. Catheters can be used instead of surgery when accessing blood vessels. During interventional radiology and cath lab procedures, on top of CAT scan, the patient may either have their skin numbed and medicated to calm the patient down, or the patient can request to be under anesthesia where the physician can either accept or reject this request. The radiologist handles the fluoroscope and CAT scan in interventional radiology, while the technologist is there to provide assistance. When it comes to the operating room, the radiologist does not need to be in there. Only the technologist is needed. The most common types of exams performed in the operating room when using fluoroscopy or any ortho procedures, transplants, pacemakers, stents, or defibrillator to help guide the blocked vessels. If a patient were to start bleeding during a procedure, the fluoroscopy would be able to detect where the bleed is coming from actively. When it comes to barium X-rays and enemas, it is used to view the gastrointestinal tract. Barium X-rays, video swallows, and enemas are barium X-rays, video swallows, enemas are where the patient needs to drink their contrast, or it may go in their rectum, which could take over an hour, where the radiologist observes on the monitor the insides where the barium solution makes a clear view. Contrast is the ability to detect differences in brightness. Fluoroscopic exams don't necessarily always use contrast depending on the type of procedure. A dye or contrast substance may be injected in the IV line in order to better visualize the organs or structure being studied. Contrast agents are often used in fluoroscopy to help separate borders between tissues with similar radiodensity. On the right is the most common types of contrast used during fluoroscopy. It looks like barium sulfate is the most common, and then there's injectable contrast. When it comes to radiation exposure, not only the patient is being exposed, but every healthcare professional in the operating room is also being exposed, where a full lead apron is required to be worn the whole time. Lead aprons can effectively attenuate certain kinds of radiation because of its high density and high atomic number. The primary source of exposure to the technologist and radiologist is the patient. The fluoroscopic exposure monitor is clipped to the outside of the apron to provide an indication of the intensity of secondary radiation. There are multiple kinds of risk when it comes to fluoroscopy. The patient dose is higher during fluoroscopy instead of general radiography because fluoroscopy exposes the patient constantly for longer times. Fluoroscopic total exposure times involves exceeding an hour or more. The nature of these procedures has led to an increase of high skin doses causing significant tissue injury. The entrance skin exposure for the patient is the surface closest to the source. Most fluoroscopes provide more than one dose level with the magnification mode. During magnification contrast, spatial resolution and patient dose are all increased. There is a case study I found of a 40-year-old male on March 29, 1990. The patient went through a coronary angiography, coronary angioplasty, and a coronary bypass graft. A skin injury occurred a month after all these procedures happened. 2 months later, his skin had the appearance of a second-degree burn. The benefits of fluoroscopy almost always outweigh the radiation risk that patients having to undergo during surgical procedures or interventional fluoroscopy. Fluoroscopy is the domain of the radiologist and is essential to a lot of procedures. Fluoroscopy is an important tool for treating diseases, detecting missing bleeds, and missing instruments. Fluoroscopy does come with risk, which is why healthcare professionals use their time efficiently when handling patient dose. I hope you guys were able to learn something from this project today.